95% of all wounds that happen in elderly patients that involve skin tears are because of falls. And most of the time, if you don't get to their skin, if you don't notice quick enough, you're not able to approximate their skin back together. They fell, you found them, and their skin was kind of apart, but you thought maybe you could get it back together. If you did that, you would use a steri-strip. Alright, so if you get to a wound and the skin is actually separated, then basically the best thing we can do is clean it, apply triple antibiotic ointment, and the only pad you should ever use on the elderly skin is this Tefla non-adherent pad, mainly because it doesn't stick to their skin. And if you're having to use one because you couldn't use a steri-strip, you don't want anything sticking to that skin, because the minute you try to pull it off, you're pulling off more skin, so you're causing more damage. You could clean it with normal saline, which is what these little bullets are, and the reason that they're individually packaged is for to keep everybody clean and safe, so we're not passing around infection. So you just twist the little top of this guy, and it just squirts out. You can use as many of these as you want. What you don't want to do is cross-contaminate from one person's wound to another one. So these will be handy, and they're in every single house in their little basket that looks much like this. So I found this little trick when I'm using this non-adherent pad, because most of the houses have that Neosporin tube. So in order to keep that from cross-contaminating anything, you can actually squirt it on the inside of here. So this little pad, you don't want to touch it like this, by the way, but it's not sticky on either side. So you can squirt the Neosporin in the middle, and then if the wound is wider than where you squirted it, you can bend it and rub it together, and then just put it on the wound. And you're going to have gloves on, which look like this. So you'll have gloves on the whole time, but if you put this on somebody's wound like this, and it's got Neosporin on it, it'll actually stick. While you're looking for a couple things. If their skin is really, really dry, you're not going to want to use a Tegaderm, which is this little guy. It comes in 2 sizes, so this is the one we mostly use because the areas are big enough that they need this. But let's say that I have no Neosporin on there. So if you needed to cover it and their skin wasn't dry and would actually hold the stick, you could put this over it and you just peel it off and it seals around. If they have really dry skin and nothing in the world is going to stick to it, you can use this gauze. This you could just wrap around. So if this was on their arm, you just wrap this around until it's secure. And then you only want to use tape on the outside of the gauze. If you stick this tape to their skin, even the cloth tape, often when you try to rip it off, it'll cause more damage than good. So those are ways that you can take care of those wounds. Of course, we always have the Band-Aid if it's small. It rarely ever is. And sometimes, because our residents have dementia and they may want to peel things off, you can use this stuff, which is called Coban. It comes in different sizes. And you can wrap it around so they're not peeling that dressing off. And it self-adheres, so it kind of hangs out to itself. The only other thing that's important to know is if you're using scissors to cut any sort of dressing, you definitely want to clean them with an alcohol pad first, because you never know where those scissors have been. And somebody falls and they have an injury, there's a place in ECP where you're going to want to document the incident so that everybody knows that that incident occurred and to care for that area. If the patient that has an incident, fall, skin tear, whatever, then they're on hospice, you need to call the hospice and let them know what happened so they can come out and take a peek, or at least know that what has happened and inform the family. And all that information is in ECP, and so that you can easily access it. It's really important that you follow all of those things so that we all know and can provide continuity of care for all our residents.